Hello, everyone. Good afternoon. Thank you so much for joining us today. And we are really excited for this unique presentation that we have. And it's also our last presentation of the year, so great way to close for this year. My name is Rosa Stalteri, and I'm part of the CanCOVID team and also the speaker series moderator. And so for today's speaker series, we're pleased to welcome Professor Leo Baccini. Leonardo Baccini is an associate professor of international political economy in the Department of Political Science at McGill University and a research fellow at CIREQ. He is also a Hoover Institution National Fellow at Stanford University for the 2020 and 2021 academic year. And so before I hand over the floor to Professor Baccini, I have a few things to note. First, we welcome you to keep your camera on during the presentation, if you please, and also ask that you ensure that your microphones are on mute just to avoid any disruptions. Our speaker series events are all posted on YouTube in about 2 to 3 days on average after the presentation. And lastly, for the 10-minute question and answer period, we welcome you to ask your question either live, or you can also type in your question in the chat box. So without further ado, please welcome Professor Leonardo Baccini, who will be presenting his exploration of whether the COVID-19 pandemic decided the 2022 United States presidential election. All right.
Good afternoon, everyone, and many thanks for inviting me to this very interesting initiative. I learned a lot from this series, and I think it's great. It's also a way to reach out different disciplines that don't often speak one with another. So this indeed is a paper that explores the effect of the pandemic on the most important political event in 2020, so the presidential election in the US. The paper is together with Abel Broder, who is a professor at Ottawa in the Econ department, and Steve Weymouth, who is a professor at Georgetown in the business school. Maybe I don't need to motivate this paper given the audience, but what we are seeing, so unfortunately the picture is now even grimmer. We are facing a global pandemic with more than 60 million of cases and more than 1.5 now millions of deaths. We are seeing large economic losses and severe limitations of personal freedom, which is unprecedented in advanced and established democracies. The situation is particularly grim and problematic in the US. The US has the highest number of cases and the highest number of deaths in the world. And what is unique about the US, and so it makes it interesting politically, is that the response to COVID-19 has been highly politicized in the US. Now, we see differences in how political parties address the pandemic, even in Europe and even in Canada. But of course, I mean, there is no one in the Conservative Party would question the use of wearing masks or social distancing in Canada. You don't see that in Europe. So there is something very unique about how the US went through this pandemic from a political point of view. And one thing that is unique about the current administration is that differently from any other administration, the US administration and President Trump in particular kept downplaying the severity of the pandemic, at least publicly. We know that privately he was obviously concerned about the pandemic, but it didn't explain to the population what was at stake as much as other leaders, including, for example, our leader, Justin Trudeau. So because the US is so unique and because the stake in this election were so high, it seems natural to see what was the effect of the COVID-19 pandemic on the 2020 US presidential election. That's the research question that we are addressing. This is an empirical paper, and so what we are doing, we pre-register the analysis of this paper in the summer. And so what I'm going to show you two things. I'm going to show you some results from a reduced form analysis in which we control for a host of potential confounders, so characteristics that affect both cases and political behavior, so COVID-related variables, demographic variables, and socioeconomic variables. And so the results here are going to be interpreted as partial correlations. Then, in an effort to strengthen the causal story. We are going to use instrumental variable, and we are going to use meat processing factor as a source of exogenous variation of COVID-19 cases for a reason that I will try to explain later on when I present this model. But I'll give you the main take of this paper so you have the results right away from in slide 1. So what we find a strong negative effect of COVID-19 cases on Trump votes. So we find that Trump lost votes compared to the 2016 election in those countries which registered a large number of COVID-19 cases. We find that this effect is stronger in urban, especially suburban areas, in states that Trump won in 2016, which are called red state, and in swing states, and this is particularly important because swing states decided the election. We also do a simple counterfactual exercise in which we show that even if we take in some state, we reduce the case by 5%, which is a small percentage, we find that this small percentage, according to other estimate, can flip those states in favor of Trump. So Trump lost those states, but if there were 5% less cases, Trump would have won those states and presumably kept the presidency. So which means that COVID-19 really mattered for this election. So this you come from very different disciplines. So I want to try to position the paper in my field. This paper fits very well in the so-called retrospective voting literature. This literature is a famous literature in political science. There is a lot of contribution, and the theory behind this literature is very simple. Retrospective voting means that voters assess the policies and the performance of a political leader or a government, and then they decide if they want to continue voting for her in subsequent elections. So our results fit with this literature because there was a severe shock, a shock that Trump did not create, he faced. The public observed his performance, and then part of the public, part of the voters decided not to vote for him, presumably for the way that he handled the pandemic. There is a large literature on the effect of natural disaster on voting behavior. And there are 2 papers listed here that show that in general, the occurrence of the pandemic has a negative effect on the probability of the incumbent to win. The US is not unique, but there is evidence of this in Mexico and in Europe. There is also literature this is also in economics that show that personal experience matters to develop political and social attitudes. And this literature, it's important because it tends to show that these personal experiences that I face now have a long-term effect. So that I remember even later on in life. Our paper also fits well into this literature. In the remaining of the talk, I'm going to go quickly through the argument. I'm going to show you the empirical strategy, show you some results, not all, but some, and then I will draw some conclusion. So the conceptual framework driving the analysis is this. So while very polarizing, definitely Trump is a very polarizing politician, Trump approval rate was pretty high among Republicans pre-COVID. And this basically for 2 reasons. First of all, economic growth. The economic performance of the Trump administration was pretty good. We can debate if it was because of him or not. That doesn't matter in politics. Second of all, Trump appointed 3 judges to Supreme Court, pleasing the evangelical base of his electorate. According to Gallup, President Trump's approval rate fell from 49% to 38% between March and June. And more than 60% of voters disapproved Trump's handling the pandemic. So the argument here is that voters were likely to associate rising local cases and deaths with an increasing threat to the health and safety. And they were also likely to see the negative effect of COVID on the economy, and as such, assess the performance of President Trump in a negative way, and then be more likely to vote against him. So the more severe local outbreaks are, the more we should see that the weaker should be the support for Trump, again, between 2020 and 2016. In the US, this is not an obvious test to make. Why is that? Look at this table. This is one of the most striking tables that I've seen in relation to COVID. You see 2 things here. Probably one, not very surprising. The first not surprising thing is that women tend to be more concerned about COVID than men. That's not unique to the US case. In general, this is the case that we see. Incidentally, countries that did the best to handle the pandemics were run by women, right? So I think that there is something there. But the second thing which is striking here, and is very specific of the US, is that Republicans and Democrats had very different attitudes towards the pandemic. The Republicans tend to downplay the severity of the pandemic. They were more reluctant to practicing social distancing. They were more reluctant not to gather, even in indoor space. And on the contrary, Democrats were particularly concerned about the pandemic, and they were willing to comply with all those non-pharmaceutical interventions. And so why is this important? Well, if Trump's attitude towards COVID-19 is demand-driven, so he behaved in that way because he knew that like his voters wanted him to behave in that way, then we should expect that the way that he handled the pandemic, even if we think is somehow like suboptimal, should not have affected his electoral performance. In a very polarized system as the US, not even a pandemic might matter because ideology trumps everything. So everything that happened is filtered to my ideology, and so it does not move the way that I vote or that I think politically. So in a sense, it's a tough test for us to see if the pandemic moved vote in the US. And in fact, when we released this paper, and as you can imagine, there was a lot of interest in this paper, some of the pushback were, well, in the end, if you were a Trump voter, you would remain a Trump voter, no matter of the pandemic. And there is some truth in that, meaning that our results hold by moving few voters. It is true that like many voters continue to voting for him, but what we show is that in a close election, moving few voters was somehow enough to flip the result. I'm gonna talk a little bit about the empirics here. Try not to add like more details. I'm happy to discuss more in the Q&A, but I think in the basic reduced form specification that we are running, the outcome variable, so the dependent variable, is the difference in vote share between 2020 and 2016 Trump vote share. Okay, so I don't care like how many votes Trump got in 2020. I don't care how much they got in 2016. I care in the same county, did Trump gain or lost, gained vote in 2016? That's my dependent variable. And the analysis at the level of the county. There are roughly 3,100 counties in the US. The main independent variables are the number of cases and the number of deaths. Cases by 10,000 inhabitants and deaths by 100,000 inhabitants. I control for a bunch of variables that we usually include in those models. Those are very common models in political science, so demographic and socioeconomic variables, but also variables related to COVID. We can talk about that if there is an interest in the Q&A. And I include state fixed effect, meaning that I'm not comparing Michigan with Ohio, but I'm comparing the counties, all the counties within Michigan and all the counties within Ontario. This because states are very different and we don't want to compare apples with oranges, sorry. I use OLS estimates with standard error cluster by state. When we do instrumental variables, we instrument COVID incidence with a share of employment in meat processing factories in each county. We use a particular industry code, animal slaughtering and processing, between 2012 and 2015, so pre-Trump. And we divided this for the total number of workers in the county in the same period to have the share of workers employed in these meat processing factories. The rationale for doing that is that there is evidence that meat processing plants became COVID-19 hotspots because like they're like usually cold environment, humid environment, is because it's difficult to implement social distancing there. And there is evidence that in these counties with meat processing factories had higher share of COVID cases, which you see here. I'm plotting the COVID cases for different percentile of this share of workers in meat processing factories. And you see like in counties with a large number of workers in these meat processing factories, so in the top 1% of the distribution, you have significantly more COVID cases than in the countries with no meat factories or with very few meat factories. Another way of seeing this is that there is a very strong positive correlation between cases, COVID cases, and employment in processing meat factories. Meaning that the more people working in meat factories I have, the more they're likely to spread the virus, not only among themselves, but also among people in the same, living in the same communities. One of the key issues with instruments, and I don't want to bother you, again, I'm happy to answer to this in the Q&A, is that they have to meet the exclusion restriction. So here what we can show is that there is a very low correlation between share of employment in processing meat factories and other covariates, meaning that those countries with a lot of people working in processing meat factories are not that different from the other countries. That's how you want to think about. And then we control for a bunch of variables that can violate the exclusion restrictions. Again, I'm happy to discuss more of this in the Q&A. But here, the important things, results, okay? Here, I'm showing you the result of OLS, what I call reduced form regression in models 1, 2, 3, and result of the instrumental variable regression models 4, 5, and 6. The stars tell you if the effect is significant. 1 star is significant with p smaller than 0.1. 3 stars if p is significant with p smaller than 0.01. So what you learn here is that with both estimates, countries with large number of COVID cases saw a reduction in Trump votes between 2020 and 2016. So Trump lost more votes in those countries that have a large number of COVID cases. This effect is there in both estimates, but is stronger, much stronger in the for the instrumental variable estimates. Stronger means the coefficient is larger and the effect is more significant. Those results hold when we include, even when we saturate this model with a lot of controls. Here is this in the simple contrast factor that we are doing. We take the 5 states that Biden won by a very narrow margin. You see 1,000 people in that's not. And what we did is that we take our most conservative estimate from an OLS, and we say, based on our estimate, what would happen if the number of cases were, for example, 5% smaller in that particular state? And as you see, in Arizona, Georgia, and Wisconsin is enough for Trump to have flipped the state if the cases were 5% smaller. How do I say that is enough? Because you see that the Trump gap is negative in the second column and becomes positive and is larger in the third column, meaning that the number of votes for Trump would increase enough for him to keep Arizona, Georgia, and Wisconsin, and therefore to keep the presidency. So even a small number of a small reduction of cases is enough to flip those states because the margins were so slim. It takes a little bit more to flip Michigan, 15% of cases less. And it takes also a little bit more to flip Pennsylvania. You need 10% less cases according to our estimate. I'm concluding to discuss the result. What do they mean? This paper doesn't tell you anything about the mechanism. Okay, so there is nothing here about the mechanism. Why this is happening is not covered in this paper. However, our results are in line with 2 possible explanations, which I discussed also at the beginning. Which are well established in the literature. The first explanation is just that voters assessed negatively Trump's performance in handling the pandemic. They saw that he didn't take it seriously, he didn't handle it well, he didn't show up to meeting, he mocked scientists, he didn't wear a mask, and he said a mask is not for me. His behavior was at odds with every other leader in developed countries. And so they might have perceived at least that his behavior increased in the number of cases and deaths in the US, and therefore some voters decided to sanction him, either because they were concerned about health and safety issues or because they were concerned about COVID messing up the economy. A second explanation is that voters have switched from Trump to Biden due to changes in preference triggered by the pandemic and the recession. And in particular, like it might be that the pandemic shifted the preference of voters, some voters, in favor of an expansion of social safety nets, in particular like a more public healthcare system and more generous unemployment insurance benefits. And on those issues, Biden was more likely to be the champion and to embrace those safety nets issues than the Trump or any other candidate in the Republican Party. If the second story is the correct one, and again, we don't have a way to tease out those two stories with our data, that implies that the Democrats are going to be able to enjoy this change in preferences, not only in this election, in which the narrative was around the pandemic, but also in subsequent elections when the narrative is going to be on other issues. This is because the previous literature has shown that those personal experience change those preferences over, for example, redistribution or government intervention in the long term. And so if the second explanation is the one at play, the Democrats are going to enjoy some advantages even in subsequent election. If the first one is the one that matters, then it's one shot. They can say that one of the reasons why they won the election is also because of the pandemic. I stop here and I thank you for your attention. And I welcome any question that you might have.
Thank you so much, Leo Baccini. It looks like we have a few questions in the chat box right now, so maybe we'll get started with those. So from SMH, actually, I'll give you an opportunity if you'd like to ask your question live. If not, I can definitely relay the question. Okay, so maybe I'll just go ahead and relay it. So the question is, would you say Democrats unplayed the response or acted appropriately?
So I guess this question is asking me to think about the counterfactual in which the Democrats were in power. Counterfactuals are tricky, so I'll do my best. I think what you saw is that definitely Biden ran a very pandemic-centric campaign. So he made it very he perceived that gave him an advantage over Trump. So that's kind of in line with the fact that like Trump was underperforming on this particular issue. I think a Biden administration would have probably handled the pandemic in the way that many Democratic governors handled the pandemic at the state level. And so we would have seen a much more, if you want, European or Canadian approach. So definitely telling voters to take this very seriously, giving an example in terms of wearing masks, and maybe a more aggressive government intervention, for example, with non-pharmaceutical policies. Maybe we would have seen more lockdown. And so in terms of like health and safety, I think the Biden administration would have outperformed Trump. I think probably the Biden administration would have caused more damages on the economy, because the economy, it's bad in the US, but not as bad as in other, for example, in other European countries. And so I don't know if that would have then created some vote losses among especially the most vulnerable part of the society, which is the one that is bearing the economic cost of the pandemic. But if you are right, I think a Biden administration would have faced smaller electoral losses than the Trump administration.
Apologies, I was on mute. Thank you so much. The second question is, was there something else that should have been done in hindsight to respond to COVID in a way that would please voters? And this is also from SMH.
Well, yes. So I think this is an interesting question. I think, and it's really beyond what we can do and show here. But I think nonetheless, I think it's a good way of thinking. I think so. Listen, this is what I think. I think Trump voters are made of two large constituencies. The first one is hardcore voters. Those are the voters that showed up at these rallies, even indoor, in the middle of the pandemic. You're not going to change them. So no matter what he does, and this comment of Fifth Avenue, they can go to the Fifth Avenue, shoot people, and he will still get elected. I think it's spot on. I think he reads his voters very well. You will never have like changed the mind of those voters. So in the end, he didn't have to do anything. I think Trump made a mistake, and if he was his advisor, he made a mistake in the second constituency. Second constituency is made by people who have conservative values. Let's say they are religious, or they are like socially conservative, or maybe they are also fairly wealthy and they want like low taxation, which is something that the Trump administration did very well. And I think Trump scared with his behavior this part here. These are like they live in suburban areas. They are typically Republican, but they were kind of horrified by the incompetence of his administration. So I think any normal Republican president would have probably handled it in a way not to scare that part of the population, and probably it would have been more likely to keep the office. So I think in that part of the population, for that part of the population, Trump poor performance really mattered in this election.
Thank you, Leo. The next question is from Karen. Karen, I'll give you an opportunity to say it live, or else I can definitely relay the question for you.
Yeah, go ahead and read it as is.
Okay, great, thanks. So the question is, are there findings from your research that can be applied to the Canadian context?
Interesting. So I'm currently filing a grant application for studying these, either also in other countries that are gonna hold elections during or soon after the pandemic. There are important countries that are gonna have elections: Germany, France, Sweden, which is an interesting case because Sweden approached this pandemic in a very different way from other countries. And so unfortunately not Canada, because Canada will have the election probably at the end of 2023. So I don't know how much the pandemic, hopefully it's not going to be that relevant at that point. So is it, in my opinion, so if I have to guess, I would not have probably done a research like this in Canada, because I don't think that the Canadian response to the pandemic was as bad as the American one. And so I think I don't know if you would see more variation at the province level. For example, Quebec has not handled this very well, although the governor here, as differently from Trump, is taking this very seriously, right? So, and he's definitely putting a lot of emphasis on non-pharmaceutical policy. So it's very, we have been in lockdown for 2 months, and things are going to get even stricter now. So in short, I don't think that so the way that politicians at the federal level, at the provincial level handle the pandemic in Canada has been good enough, given the circumstances, that I don't think it's going to matter a lot in the next election. And I think it would not have mattered as much as it mattered in the US if Canada would have held elections today. But that's very speculative, and I might be, of course, wrong.
Thank you, Leo. So we have about a minute left before we end the presentation. Are there any last minute questions before we close? Maybe, Leo, you can just touch upon your covariates in your regression model. You said that you would talk about them in the discussion. If you just want to touch upon how you guys chose them. And
yeah, so I think okay. So for the reduced form analysis, basically we included variables that are included in every model predicting US voting, and there is a large literature. American politics is probably the strongest subfield in political science. So we didn't invent anything. We just followed what has been out there for quite a while. We added, of course, COVID-related variables. For example, exposure to the disease or infection, physical proximity. We had data on social distancing based on the phone GPS. Because, for example, that's important. Why? Because social distancing, it was less respected in Trump states than in blue states. So Republicans misbehaved much more than Democrats. And so that effect is affecting both voting behavior and cases. So for us, this is an important variable to control. I think that the trickiest thing with the instrumental variable is there a way in which meat processing factories would have affected voting behavior regardless of cases, so not through cases? That's always very difficult to kind of like show. And so there, like, we control, for example, for share of manufacturing in food manufacturing in particular, the so-called China shock, which is how much the competition of China affected counties, manufacturing layoff, particularly in the meat processing factories, and the effect of tariff wars with China, which also affect the meat processing factory industries. In general, we were very afraid that manufacturing would have affected both COVID cases and voting behavior. And we didn't want that, because we wanted the effect to go through share of people working in meat processing factories and then directly in cases. And so we are making an effort here, like, to control for those variables so that the effect does not go into residuals and allow a more convincing causal effect, or believe that, like, this, the coefficient that we get can be interpreted in a causal way. Of course, instrumental variables are not perfect, so there might be, they're as good as we are able to account for all the possible channels that correlate with our main predictors, so cases, and with voting behavior, so we call them confounders. So insofar that we do a good job there, we can interpret this in a causal way, but that's always very tricky. We do also some tests, sensitivity tests. If we are wrong, how much do we have to be wrong to our, like, estimates somehow, like, go south? And our estimate seems pretty robust. So that's, I think, what I would like to add on the empirical part. And if there are any final questions on this, I would be happy to elaborate even more.
No, that's all great. Thank you. It's so interesting. We're out of time, though. It's 4:33, but I would like to just close and just thank you on behalf of the CanCOVID team and network for your time to present to us on this interesting and very timely research. And this recording will be available on YouTube in about 2 to 3 days. So if you'd like to rewatch or send to some family or friends. The other thing that I would like to note is that, given that this is the last speaker series for this year, on behalf of the CanCOVID team, we wish you all a safe and happy holiday, and also a great start to the new year. So thank you again, Leonardo Baccini, and I hope you all have a great evening.
Thank you so much for having me. It's been fun, and happy holidays to everyone. Stay safe, and also Happy New Year.